Hi, my name is Dr. Laura Tickler. Welcome. This YouTube channel is about giving you some good medical information. At the end of the medical information, I do give some spiritual information. You do not have to stay throughout the whole video and listen to that part if you don't want to. Once I'm done giving the medical information, I will let you know, and then you can just click away if you don't want to hear the spiritual part. This channel is not meant to give you specific medical advice. Please do see your primary care provider so that you can get medical advice that's tailored specifically for you. Lastly, please like and subscribe. So today we're going to talk about chronic kidney disease. This is the third video on the topic. We're specifically going to talk about staging and complications. So staging is important because we might give you different treatments or ask you to do different interventions. For example, at stage 3B, we commonly would refer you to a nephrologist, which is a kidney specialist. So staging is important. I want to tell you that often patients don't know that they have chronic kidney disease until they have stage 3. How can that be? It's just that we've been learning a lot about chronic kidney disease through the years, and we are getting better at it. Prior to the past 5 to 10 years, if we saw some evidence of kidney damage, we would tell you to drink more water, to have certain changes in your diet. We didn't have a lot of medications to treat chronic kidney disease a decade, 2 or 3 ago. But now we're getting more knowledgeable about the subject, so it just makes sense that we're going to be more attuned to making sure we diagnose you correctly, and then letting you know your risks and helping you throughout the course of the illness. So it is possible that you can have chronic kidney disease right now and you might not know it. So please make sure you see your primary care provider and ask about it. So chronic kidney disease stages. Basically there's stage 1, 2, 3, 4, and 5. And then I'll add on a stage 0 and a stage 6. So stage 0 means that we can't find any damage to your kidneys, and I talked about how we find that in the previous video. But you have risk factors for chronic kidney disease. So you don't have any obvious kidney damage, you don't have chronic kidney disease, but you have risk factors. So we're going to have to keep an eye on you. But stage 1 is where we actually found damage to your kidneys. And like I said, I explained that in a prior video. Stage 2, same thing. We have damage to your kidneys. Stage 3, 4, and 5, yes, we can look for damage to your kidneys, but we don't have to have documentation of the damage because stage 3, 4, and 5 is by definition where the filter rate of your kidneys is so low that it's obvious you have damage. Okay, so stage 1 of chronic kidney disease, the filter rate or GFR is greater than 90. Stage 2, the filter rate is 60 all the way up to 89. What confuses the matter is that the lab typically states that if the filter rate or GFR is greater than 60, it's normal. It doesn't flag it. So I can see where a patient might think everything's fine, and the doctor, like I said, they might not label you with the condition or look very hard for damage. They might just be giving you advice. But it is important that you know if you have chronic kidney disease. And then stage 3, 4, and 5. So stage 3 has 2 parts, A and B. So chronic kidney disease stage 3A is a filter rate of 45 all the way up to 59. So on any lab results, that's going to show up abnormal. So that's helpful. At chronic kidney disease stage 3A, you don't have to see a kidney specialist, although every now and then I have a patient ask me if they could see a specialist. And of course, whatever they think they need, I'm going to go ahead and do it for them. It's okay to establish, if you know that, say you have diabetes and it's pretty severe and we're pretty sure that the diabetes is causing the kidney disease, then it's possible it's going to progress. Well, all chronic kidney disease can progress, but if you know that you have the most common cause, which is diabetes mellitus type 2, and like I said, maybe it's uncontrolled, and you have chronic kidney disease stage 3A, maybe the patient or the doctor might suggest maybe we'll just establish with a kidney specialist now, but that's pretty rare. Usually you don't have to establish with a nephrologist or kidney specialist until you have chronic kidney disease stage 3B. And 3B is 30 all the way up to 44. 30 to 44. And then stage 4 is 15 to 29. Now, often when patients get to that stage, they start talking in terms of percent. So if I tell them that their filter rate is 20, somehow it translates where the patient says, oh, my kidneys are at 20%. Or they'll tell their family, my kidneys are at 20%. And you do hear that. That's not really correct. It's just the filter rate. We don't typically give a patient the percentage of the kidneys that is still healthy or the percentage of the kidneys that are damaged. We don't typically have a way of figuring that out for you. So how we manage the condition is we stage it with how fast the kidneys are filtering the blood. So the blood presents itself to the kidneys, and then the kidneys are a very sophisticated filter, and then they'll filter in a certain rate of time. So it's milliliters per minute. And so the slower it gets, it just means the kidneys are damaged, so they just can't do their job. But honestly, if you talk in terms of percent, it's okay. We all understand that. And it's kind of understandable that you're kind of seeing that way. Like the damage is getting more severe. You have less and less percentage of healthy tissue. It's kind of how patients think about it, but that's really not accurate. It's really just how fast the kidneys are filtering the blood. So stage 4, the number is 15 to 29, and stage 5, the number is less than 15. Now on stage 5, you don't have to have dialysis, and you might stay at stage 5 a very long time. Or some people might be on a list for a kidney transplant. There's just a whole bunch of variables why you might not progress to dialysis quickly, or you might progress to dialysis slowly. And I explained a little bit about how to avoid progression of the disease in the prior video. But stage 6, typically we think of it as dialysis, and we're not going to talk about that today, but I will talk about it in a subsequent video. So I finished telling you about the stages, and then you can go to www.kidney.org. It's the National Kidney Foundation. And then you can just type in the search box GFR or filter rate staging, and then you'll see all the numbers I just told you. So kidney.org, the National Kidney Foundation. And then before I go to the list of complications, in the prior video, I told you I would put the generic names of 2 common medicines we use to treat chronic kidney disease to help prevent the progression of the disease. So I did one better. Instead of putting the name of the medications in the links below, I just went ahead and put a link to an article I wrote, a medical article I wrote. It's entitled Making Sense of GLPs and SGLTs. But anyway, the link is in the list of my links, my important links. Like I put the link for familydoctor.org. So both of these links, the article I wrote and then the familydoctor.org and then the kidney.org, those are all helpful links. So you're going to learn a lot about the medications I just mentioned. There are some other medications that your primary care doctor like myself or your nephrologist might prescribe. Statin medications might be prescribed. We have various reasons for doing that, and I'll explain a little bit about that when I get to complications. And aspirin might be prescribed. Okay, so let's move on to the complications. So this is in no particular order. I'm not trying to have a scare factor here. I'm just listing the complications. Okay, so chronic kidney disease puts a patient at risk for a stroke. And it could be the ischemic kind or the hemorrhagic kind. Ischemic is the most common type of stroke. It's when there's like a blockage. So the blood's trying to flow to a certain part of the brain, but then it gets blocked. And the way I explain it sometimes to patients is just think of like in your bloodstream, say there's a glob of cholesterol, think of like butter or fat. And then in the bloodstream, there can be calcium freely flowing and many other minerals, electrolytes, of course. So you have the cholesterol or the fatty glob, and then the calcium, this mineral, might kind of just attach to it or get inside of it. Think of it like a kid's slime. You know, I'm old enough to when we were exposed to slime, it was just slime. But then nowadays, like the kids put little gems in it to make it like a textured slime. That's, anyway, a good way to explain it. Okay, so this is the wall of your artery, and this glob attaches to the wall and forms a plaque. So in our body, even stones aren't necessarily permanent, like gallstones or kidney stones. The chemistry can go both ways. It forms a plaque, and then it can it's adhered to the wall, and then it could not adhere to the wall, or it could peel off. Or same with a gallstone or a kidney stone. It's not written in stone, haha, pun intended, that it's going to stay that way. The chemistry can go backwards. It's just that when we have a plaque form, it's just unusual for it to be reversed. It can be, especially with maintaining an ideal body weight, no smoking ever, and eating a strict vegan diet. Those three things would be very helpful to help reverse. But that's really rare. It's just a rare individual that could achieve that. So a lot of times when you form the plaque, it's there, so we might give medications to help prevent progression of the plaque. But anyway, the stroke oftentimes is caused by the fact that a capillary or tiny blood vessel in the brain just had too much clog, too many pizzas, too many hamburgers, and it's clogged up like how a pipe in a sink gets clogged. And then the brain tissue distal to that, past that clog, can't get oxygen, and then that brain tissue dies. That's a stroke, and that's the very common type. But there can also be a hemorrhagic stroke, which happens in about 15% of strokes. And that's when, for whatever reason, the blood vessel bursts, for example, and there's a bleeding out. And then the blood is out of the place it's supposed to be. It's in the brain tissue, and it's putting pressure on tissue around it. And that's another way that the brain tissue can die. So there are ways to prevent stroke. You want to do some of the treatments I talked about in the prior video, but aspirin can help prevent it. Statin medications can help prevent it. Okay, the second complication is heart attack. And if you think about it, that makes sense that the heart would be stressed out, that the kidneys are stressed out. So if the kidneys are not removing the nitrogenous waste out of your body through the urine, then that waste is building up in your bloodstream. And that graphic picture that I just explained, how the glob of butter, so to speak, is in your bloodstream and it attaches to the wall. I mean, just think if there's just like waste in your arteries, how harmful that would be to your body. And then your heart gets stressed out by that and can't work very well. Chronic kidney disease makes you prone to have more inflammation in your body. So chronic kidney disease can cause more inflammation. Inflammation in the body can harm the kidneys and harm the heart, but I'm just talking about the chronic kidney disease itself harming the heart. And then anemia is a complication of chronic kidney disease, and anemia itself can stress the heart. Also, the heart might have to work hard because there's just so much waste in the bloodstream, and the heart is having to work hard to deliver the oxygen everywhere, and that's stressing the heart out. And then the chronic kidney diagnosis does increase the likelihood of calcifications in the arteries. Remember how I was explaining how the calcium could kind of join with gunk and land on the artery wall. So for all those reasons, the heart could be stressed. There are ways to prevent heart attack, and I will eventually do a video on heart attack alone. And then another complication, so we talked about stroke, heart attack. Another complication is heart failure. And if you think about it, that makes sense. So if the heart is working really hard over time, it could eventually become weak. And that's a whole nother video. I do plan to make that for you. And then pericarditis, it's fluid around the heart that speaks to inflammation and a fluid buildup. That is a problem. The heart can't beat like it's supposed to if it's pushing against pressure, water around it. Bleeding disorders, neuropathy. Neuropathy just means you'll have numbness, tingling, and burning in various parts of your body. And we'll talk about neuropathy in a separate video. Restless legs is another complication of chronic kidney disease. Immunodeficiency, what that means is that when you have chronic kidney disease, you can't fight off infections very well. Dry skin, dyslipidemia, and hyperlipidemia. So that means that your good cholesterol might be low, your triglycerides might be high, or even your cholesterol might be high. So the lipid panel, the fatty panel, might be abnormal. And that is a risk factor for heart attack and other problems, and it can be caused by chronic kidney disease. pH imbalance, so the kidneys are one of the organs in the body that help maintain a good pH, how acidic or basic, alkalytic your blood is. And so you can have a pH imbalance because of the kidney disease. Electrolyte imbalance, I think patients are very knowledgeable about whether or not their potassium is too high or too low. Fluid overload, so I was mentioning this a bit in a prior video. The kidneys are one of the organs where if the kidneys don't work well, then the fluid builds up in the body. Interestingly, if you have chronic kidney disease, you can have too much sugar in your body, or the sugar can go too low. So either way, it can actually affect the sugar level in your body. Chronic kidney disease itself can be a cause of high blood pressure. And high blood pressure is its own condition, and it's also a risk factor for heart problems. Malnutrition, and that's because if your kidneys are not working right, you can have too much of something in your blood, too low of something in your blood, and you might not be getting everything that you need to grow and do all of your metabolism properly in your body. Too much phosphate, too much potassium, for example. So I've covered some of the complications, and you can go to kidney.org if you want to learn more about those complications. So I have finished the medical information for this third video. I'm going to start with the spiritual information. If you don't want to hear that, you can click away at this time, but please like and subscribe. Okay, so for the spiritual information, as I said in the other videos, I am a devout Christian. I am not trying to proselytize or turn you into anything. It's just that I have noticed myself, having practiced almost 25 years, that when patients have a spiritual faith, religion, spiritual discipline, they tend to have better outcomes. And some of the scientific literature does support that. But also, I have a firm belief that it's important to be saved, that salvation is something that we need to pray about and yearn for. And even once we're saved, we still want to have a close relationship with God, love ourselves and love God. So I'd like to close this video with a prayer. That's what I did at almost every chapter in my first book. I'm going to show you that book. You can buy it on Amazon. So it's called You're Saved, A Spiritual Perspective from a Doctor and Military Spouse. Yes, I am a military spouse. And my name is Laura Tigler, MD. So you can buy this on Amazon. And then you can go to my author website. The link is on this channel if you want to learn more. I am writing a third book right now, and I have a second book, obviously, that's already out. Okay, so let us pray. Dear God, please give me the strength and wisdom to always know my heart. Let me shower others with the love that is in my heart and never hold that love back. Let me love others even when loving them means certain pain and even death. Let me be obedient even unto the end. Amen. All right, this is the end of the video. I will see you next time.